over 30 years, Point of Grace has shared music, faith, and friendship with listeners across the country. Now Denise, Lee, and Shelley are inviting you into their circle. Welcome to Circle of Friends, the podcast.
It's Point of Grace.
Each week they're talking real life, current events, stories of true friendship, wisdom from God's Word, and all their favorite things. If you're looking for a little company, a few laughs, and a lot of Jesus to hold it together, Circle of Friends, the podcast is waiting for you. Subscribe now wherever you listen or watch podcasts, and circle up with Point of Grace.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer Speaks. This is Lori LeBay, and I'm thrilled you can be with us. As always, we like to kind of push you towards checking out our website with all of our free educational resources, as well as our sister company, Dementia Map, which is a global resource directory. But today, our show, we are going to be talking with the president and founders of Nana's Book Foundation, where they have given over 20,000 books away in the past 4 years, helping educate children regarding dementia. So, with no further ado, let's go ahead and talk with Dennis. Well, Dennis, I have wanted you on the show for many, many years. And so I am so thrilled that we're actually able to connect today and get the word out on what you're doing with Nana's Books Foundation. So to get started with our audience, if you don't mind introducing yourself, because you can do a much better job than I can.
Happy to. And Lori, thank you for this invitation. It has been years since we wanted to connect, and I'm glad we finally are. So I'm Dennis Dulniak. I am the president and founder of the Nana's Books Foundation. But before that, I was in higher education for 40 years as registrar at various universities throughout the country, having to retire when my wife, Nancy, received her diagnosis, her terminal diagnosis, for mild cognitive impairment that then was diagnosed officially as early onset Alzheimer's at age 62. And that was a turning point for me and her. And I wish I can go back in time, but we can't. Hindsight is wonderful. And so I actually had Nancy retire officially before we actually did the testing for her diagnosis as early onset Alzheimer's. Because even with mild cognitive impairment, that is a disability. And Nancy and I have been paying for disability coverage for years. And she would have been eligible to receive disability insurance once we got approval, but we did not take that vein. And so now in seminars and training sessions, I make a point that if people are thinking they are having issues and they're still working, to get tested first. And I talked to supervisors about this. Matter of fact, in 3 weeks, I'll be talking at my professional association, where I will talk about this with their supervisors, because this is happening in all of our communities, in all of our environments. And I wish I had a chance to talk to HR people, because it is through them that they can help identify and screen some of their employees that are having memory issues or struggling through some of the cognitive abilities that they have been performing at a high level. And I know Nancy, as a librarian, had to deal with complex situations. And so it was sad when she came home in tears, having difficulty of her on the job. And we didn't know what the problem was.
My mom was the same. My mom was a proofreader for Deluxe Check, and she used to carry a 3-ring binder back and forth. So if she got stuck, she could push herself through. But she was terrified, just terrified of losing her job and the stress of going to her job and would it flow today or would she have glitches was horrendous. And, she was misdiagnosed for 10 years. They just kept saying, it's menopause. And she kept going, this ain't my girlfriend's menopause. It's different. We talk about it. But that was 40 years ago. But people are still running into these issues with misdiagnosis or afraid to go in to get diagnosed.
Yeah, a lot of fear or denial that, no, I don't have that issue. But it's simply getting them tested appropriately. And we have many tests now that can test them on various levels. And so I'm highly encouraging people who talk to me about it, since they know that I am highly involved in this issue with dementia now. I'm happy to do that. But with Nancy, her diagnosis created opportunities for us to advocate for teaching people about the disease. And she was also a strong educator, too, of helping people understand what it was like to have early onset Alzheimer's. And so we traveled extensively for 4 years, including dementia-friendly cruising, which is a niche that we found early on. And I eventually got into then being part of their support team after Nancy could no longer travel. Because having a support team on a cruise ship in small groups can still increase that quality of life experience. And that worked out very well for her until she was not able to travel any longer. This disease is very, I would say it's a devastating disease that takes away and steals one's sense of abilities. And travel is one of them. Being lost is one of them. Not sure where they were when they went into a restroom, which door they come out of. And so we learned a lot through this. And eventually her disease progressed to the point where the stress level on me in the home was too significant. And it was important that we have her in a safe environment. And so we did place her in a memory care community where she thrived. And I have to say, once she made the adjustment after a few days, she actually did well there. She was just unmistakably a good part of that until she became too aggressive. And I learned through an autopsy after she passed away that not only did she have early onset Alzheimer's confirmed, but she had Lewy body in her amygdala. And that explained a lot of her reactions, a lot of her tendencies where she can just blurt out and become aggressive. And so that was very helpful. We participate in the Brain Bank, which is a program in the state of Florida. And if other states have a brain bank situation, I encourage others to seek that out, because it can certainly help families understand the nature of this disease and help them prepare for any other people who are still alive who may be struggling with this journey in the family or offspring as well.
Yeah, my mom, we did an autopsy with her too. Minnesota had a brain bank through Health Partners, and they don't do that anymore. But Dr. Fry, who, he's been doing this since the 70s, I had him sit down and kind of go through the autopsy with me. I said, because some of it's mumbo jumbo, all the medical terms and stuff. And he literally gasped when he saw my mom's report. And then he apologized. He's like, oh, I shouldn't have done that. I've never done that. And I said, well, can I ask why you gasped? And he's like, Lori, you were right. Your mom's been living with this disease for 30 years. I have never seen a brain even close to this atrophy. And he said, but not only did she have Alzheimer's, she had Lewy body and Parkinson's too, which those two things were never, ever mentioned to us at all. And still today, I'm not hearing doctors prepare people when they give a diagnosis that, hey, this could change. you could end up, moving from the MCI to an Alzheimer's or something else. You could have more than one type of dementia. And so people, they get used to it and then all of a sudden they're taken back again. And it really builds a distrust with the medical professionals because they're not letting people know that this could happen. And if they knew, they would be looking for different resources as well. If they're seeing different types of behaviors creeping up. That's my thought on that.
The word mixed dementia is rarely used among physicians. And so learning the fact that, yes, even though you're hearing the word Alzheimer's very frequently, and that's the predominant disease, now Parkinson's is becoming even more known and actually has more people diagnosed with Parkinson's than Alzheimer's. The fact that people don't get diagnosed with it. I thought Nancy had Parkinson's because of her tremors that she had, but the doctor did not diagnose that, and it did not come up in her autopsy. But I do encourage people to do this.
Yeah, exactly. Now, I know you also probably experienced the time of COVID and the isolation and how that affects people. Do you want to speak on that?
Yes, that was the worst of it. Nancy was in memory care at the time, and I remember being in her facility March 17th, taking pictures of her, which is the last time I got to see her in person for 28 weeks. The isolation of not being able to be close to her, to touch her, to give her the love and support that I was able to was deadly. Because isolation kills. And her regression during those 28 weeks was very, very significant. And it was a sad thing that could not get into the facility. We could maybe see each other through a glass panel. We could try to talk on a cell phone or a tablet, which she could no longer connect with. And so, whereas I could see her, she didn't understand that I was the person in the picture on the tablet. And so the communication was basically non-existent. She didn't talk on the phone. And her deterioration, I could tell, was quick and significant. And finally, when I did get a chance to visit her, we had to be garbed into costumes and masks and shields over the face to where it was so unordinary. And then we had to keep a distance across a table.
Yeah.
And so it was so artificial without that contact that people thrive on.
Well, and just how confusing to someone who's not processing the way they used to. You can't even explain why you're doing what you're doing. And, being unrecognizable with all, like you said, the garb on and stuff, and the different type of connection. I can't even imagine what people with dementia were going through. I can't even fathom the isolation and probably frustration and probably scared too, because it's like we look like we were in a sci-fi movie. This was not our norm at all with things.
Yeah.
Well, I want to talk to you about Nana's Books Foundation and how it got started. And there must have been, I usually find when I talk with people, there was one thing that just kind of pushed them over the edge. A lot of times it's kind of clawing at them. And then this one thing just goes, okay, Off the stick. Here we go.
For over 30 years, Point of Grace has shared music, faith, and friendship with listeners across the country. Now Denise, Lee, and Shelley are inviting you into their circle. Welcome to Circle of Friends, the podcast.
It's Point of Grace.
Each week they're talking real life, current events, stories of true friendship, wisdom from God's Word, and all their favorite things. If you're looking for a little company, a few laughs, and a lot of Jesus to hold it together, Circle of Friends, the podcast is waiting for you. Subscribe now wherever you listen or watch podcasts, and circle up with Point of Grace.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And
it's an interesting beginning because my son Mark, who lives in Knoxville, when giving Christmas presents to Nancy really didn't matter anymore because she didn't need anything. She can't wear anything. She can't really do much. Mark said, I'm going to honor her by giving books to kids in a Title I school to a teacher who he went to school with.
Oh,
and
cool.
The first class, I think, was 30 some odd kids. And so Mark picked out books to give, and the kids wrote back to Nancy with thank you notes that she just gloated over. And so it was a thrill for her to connect with kids on literacy, on reading, on education. And so for a couple of years before she went into memory care, she was able to actually connect. And Mark did this annually. And when COVID really took Nancy down and she had to be placed into a nursing home because her memory care community had 40 out of the 60 residents test positive for COVID, and they could no longer handle them. Nancy's deterioration declined even further. And so when Mark made his last visit, before he left, we talked about how we can honor Nancy because she was going to be passing on shortly. And we came up with this concept of starting a foundation that carried on the concept of giving books to students in Title I schools. And so we made the connection of making the books grade appropriate on topics dealing with Alzheimer's and dementia. And then my other son, who happens to have a son with cerebral palsy, said, let's add disability to it. Mm-hmm. And the disability aspect is very broad because it affects not only people with dementia, it affects their kids, the kids in their classroom. It affects other family members. And as I found later on, we have over 25% of our country with one or more forms of disability. And for every person with a disability, we have at least one or two that are caregivers for that person. And so when you do the math, that's 3/4 of our country affected in some role, either as caregiver or as a person with a disability, whether it be dementia, Alzheimer's, Parkinson's, or any of the others that are out there. So it got started, and it was very interesting because we came up with this concept. We came up with the name Nana's Books Foundation because Nancy always wanted to be called Nana.
I love it.
And she loved owls. And so I had a friend of mine come up with the logo that incorporates the owl's eyes and the figure in the form of books that just made it work. And so between the tears on Nancy's deathbed, I was able to tell her that we were starting this foundation in her honor. And I had signs on her wall that announced this. Now, could she read them? I don't know. Could she hear me? Yes, she can. Because hearing is the last thing to go as a person passes on. And so when I would go back and visit her, I would remind her that we were doing this foundation. And the first books we gave to all kids in her elementary and high school in Granville, New York, which is where she graduated, and the public library, where she actually volunteered. And there's a story behind it that we place in every book talking about her history and her background.
Oh, that is so precious. I just, I love that your son understood that gift giving changed, because we don't talk about that much. But the power in the books is so important. The education, the connection. I used to go into the schools and talk. It was more junior high and high school, and I haven't done that in years, about aging and dementia. And I was shocked at how many of the kids put their hands up when I asked, are you caring for somebody, when you get home from school? And they were shocked. They all looked around because it was something no one talks about, and the emotions. And one of the things that stood out to me was how they said, I'm supposed to watch them, but no one really includes me on what's going on. Their whole dynamics in the house has changed, and they all really wanted to help. And what I found and I'm sure this is happening with your books, when I went out and talked about it, that conversation came home, just like the books would go home, and let them be part of the active care partner circle. And because they look at things so differently than what we do, and they can offer different things than we can when we're older, because we just have different perspectives of even what's possible, because we've heard for probably a longer period of time that somebody can't learn and they can't try anything new. And the kids are kind of like, heck with that, let's try. Or there's this app, we can do this, or we can, and they just get this excitement over it that, and I think we've lost, even through COVID and stuff over the years, we've kind of lost our creativity. And through COVID, I think people, as much as that kind of went away, it reblossomed and pulled people back into how do we care and what are the effects, and finding out little things really, really matter. Really, really.
Yeah, initially, I had difficulty finding books
Mm-hmm.
that were good enough to put into kids' hands.
Mm-hmm.
But it grew to where I was able to establish a good cadre of books. And now I have a listing that exceeds over 150 different titles that are
Fantastic.
grade appropriate. And I've categorized them by level of the intent or the content that is there. And I just keep adding more and more and vetting more as the books go on. So I'm in a situation now that I'm challenged to figure out how I'm going to distribute our list to the 5 schools that we're giving books to this year. Because over the last 4 years, Lori, I have to be proud of this fact. We have distributed over 20,000 books to 24 Title I schools in 11 states in the District of Columbia.
Wow. Wow, that is fantastic.
So every year I'm adding new states
Mm-hmm.
to our list, because my goal in life, God willing, is to distribute Nano's books into each of the every 50 states and DC.
Mm-hmm.
And because of our closeness to Puerto Rico, that might be also possible, because we do have a significant amount of Spanish titles. And I'm finding that many schools have a lot of Spanish-speaking kids. and come
Yep.
from ESL. And so that is very significant. And like you were talking about how many kids know someone who has Alzheimer's or dementia. Some of the books I give deal with the disabilities. And a book I typically read is something on autism. And I'm finding that autism is so common that it's no longer a word a first grader doesn't hear. And yet, being able to teach compassion, kindness, understanding, the caregiving approach that, as you mentioned, they're going home and having to take care of grandma or grandpa, not knowing what's behind all this. Well, with the disabilities and autism, they're taking care of their brother and sister and cousin. And that's another factor that I think is vital in what Nana's Books is doing.
Yeah, there's such an overlap with care too. I mean, my focus is dementia and caregiving at large, but I don't care if someone has cancer or a disability or, it could be 10 million things. The basic concepts of care, choice to care, and actually, the pushback of care sometimes, because I know for me, I want to be independent. I don't want to have to be cared for at my age. And so you have to understand kind of the psychology of some of that too. And so, like I had mentioned in my book, Betty the Bald Chicken, Lessons in How to Care, it asks, like, I don't know, I think there's like 10 questions that get people to think about, have you ever been like Betty, who gets ostracized and pushed away? And we've all felt that, and the kids have too. And we typically will feel that multiple times throughout our life. And then, have you ever been, I call them a barnyard animal, that stepped away because they couldn't deal with somebody that needed help? And that could be time, money, not understanding, all of those types of things. And then there's the caring corral that doesn't look at the person as being a disease or disabled. They just want to help, their fellow man. And in trying to remove the guilt out of those things too that happen to us, because we can't always be there for everyone all the time. Sometimes we have to take care of our own self. But again, being able to talk about those things and maybe asking someone else to step in. I mean, there's just so many different ways to approach and look, but I think we don't have those conversations acknowledging something's off and somebody needs help, and how we feel when we help somebody, what that does to us typically brings us joy. And so all of that stuff is so important. And like you said, there's so many books out there now. I know All's Authors has curated just kind of a children's section, and I don't know if that's somebody that you look to at all for certain titles and things, and those have been vetted. But and then there's so much self-publishing and stuff going on. It's like, but you have to vet them and know, is this going to work in these situations as well?
Well, one of my board members came from Al's Authors.
Oh, who's that? Can I ask?
Yeah, it's Deborah Mills.
Oh, okay, wonderful.
Deborah wrote a book about her mom because her daughter struggled with what's happening to Granny.
Uh-huh.
And so her book is Granny Needs My Help. And it's adorable. And I love these books that I get that show people in the same culture, the same color, the same mixed generation. It's just so multicultural that there's the Alzheimer's Foundation of America that has published several books in both English and Spanish that are just wonderful. And I love reading them, but sometimes I cry at the end of them because it just hurts knowing I've experienced this myself.
Yep.
But it's the true emotion. It's the love I continue to have for Nancy, even though she has passed on.
Well, and I don't think we can change how people care until we shift them from a mindset to a heart set. where they actually feel the need to care. We have to get behind the whys, and then, how that impacts and changes the relationships and allows them to still grow, even though they're different, and expand. And, I just think so many people think, well, they can't talk to me anymore, so there's nothing left. I just interviewed a gal, Rachel Savage from she's from the UK, and she has a theater called the Vamoose Theater, and her plays and her training are all about communicating non-verbally with people, and she's just brilliant the way she goes forth, but she's just busting down some of those stigmas that we have been taught year after year after year. And as we hear more stories from families of what they're experiencing and how we can participate in care, I think it's those human stories that connect people, and go and make it real. Like, well, if they did that, maybe I could do that too, or I never looked at it like that. That is so critically important. I want to just let people know, if you're just tuning in right now, we have been talking with Dennis Dulniak, and he is the president and founder of Nana's Book Foundation, who is doing fabulous work. And we will have all of his contact information for you. But the easiest way to reach him, of course, is just go to nanasbooks.org. And Nanas and books are both plural on that. And he's on Facebook as well, personally, and also through the foundation there. And you can sign up for his newsletter, which is really interesting as well, too. But I want to also do one shout out. I like to shout out to my webmasters, Q for Good. They are absolutely fantastic. They are very much on board with social good and like working with companies that are making a difference in the world. And so if you're looking for an organization that can help you get out of the black hole or maneuver all the updates and things, and be reasonably priced and communicate excellently, check out Q for Good. They are absolutely fabulous. But let's get back to Dennis now, because your story is just incredible in the work that you're doing. And, I love that you've got your family support with your son and how involved he is, with all of this too, is very cool. I'm wondering, in terms of, costs money to do all this stuff, and I know you're a nonprofit, but then that means you got to apply for grants, and that's a whole leap of itself. Not everybody knows how to maneuver all that. So how do you stay afloat?
For over 30 years, Point of Grace has shared music, faith, and friendship with listeners across the country. Now Denise, Lee, and Shelley are inviting you into their circle. Welcome to Circle of Friends, the podcast.
It's Point of Grace.
Each week they're talking real life, current events, stories of true friendship, wisdom from God's Word, and all their favorite things. If you're looking for a little company, a few laughs, and a lot of Jesus to hold it together, Circle of Friends, the podcast, is waiting for you. Subscribe now wherever you listen or watch podcasts, and circle up with Point of Grace.
Want to keep God's Word with you wherever you go? The King James Bible Study KJV app by Salem Media makes it easy to read, study, share, and pray daily with the timeless KJV translation. Enjoy features like offline access, audio Bible listening, smart search, and tools to highlight, bookmark, and take notes, all designed to keep your Bible study simple and organized. Best of all, it's free to download in the Google Play Store. Grow in your faith every day. Search for King James Bible Study KJV and download the app today.
With everything. That's something that I think is important for people to know. I would imagine they could make some donations to you as well. But talk to that a little bit, if you don't mind.
Sure, Lori. That's always the big challenge for the nonprofit. Mm-hmm. And I'm happy to say that we have been able to stay afloat and continue to project confidence, because we have some key donors that are contributing to be key donors, as well as a grant that has doubled their donation to us, allowing us to buy more books and expand our resources that we can donate. But yes, personal donations are definitely needed. We have many ways that it could be collected, and that's through our webpage and through Facebook as well. But we are also supported by volunteers because as a nonprofit, none of us are paid. We are all volunteering our time. All the board members, all the executive board is all coming in as volunteers, and we could use help in suggesting book titles, in vetting books for us. I just got a librarian who reads Spanish that's now able to vet both our English and Spanish version books so that we can include them. And I love the fact that some of these books are coming in multiple languages, but we need other languages because as we get into more Title I schools, we're finding more cultures, more backgrounds, cultural heritage. And so looking forward to expanding some of that and finding good book titles on Alzheimer's, dementia, and disabilities that come in multiple languages. So that's a need we have. And then we really do need some more board members with key expertise to help us with the marketing, the grant writing, the fundraising, the social media. It becomes endless in terms of as our organization grows, our needs grow. And I know our board has continued to set some goals that's going to challenge us for the next 3 years. And part of that is fundraising. And so that grant writing piece, finding foundations, corporations who can buy into the fact that supporting Nana's books with a donation can bring books to their community. And they can then advertise the fact that they're supporting education, supporting this disease, and a disease that affects a quarter of our country by just providing books to students and the public library. And I think this is an easy win-win for corporations if, in fact, we can reach them and connect with them. But I guess my final goal is finding a real major donor to endow something for ongoing operations. And that endowment may come from a family member, significant breadwinner who wants to recognize the loss of family members to this disease and wants to help other people. I know they're out there. I just haven't reached them yet. And so, yes, as a nonprofit, we have opportunities where they can support us financially, or they can support us with their talents. And so I'm hoping that this operation will continue to grow beyond me because succession is important. And for Nana's books to exist 20 years from now, we're going to need definite new blood in terms of leadership and direction.
See, and so many organizations don't think about that, especially when it kind of blossoms from a family or purposeful need. You know, it's like, well, I'll just do it as long as the All's authors just transition because the ladies are going to retire over to All Home Care Matters now with Lance Slatton. And, you know, I was so thrilled to see that versus stuff just kind of falls by the wayside. And it's so greatly needed. I was thinking of money, and maybe you've tapped into like the libraries I know have some funding, and even the gambling resources. I've been told will give you, and it's not a ton of money, but $500 pretty easily in the different cities. And if you can get the cities behind it, the school districts, you know, that could add up substantially. But sometimes it's just having the right person behind you in that city that knows somebody to make those connections can be huge. Or some of the different groups that are out there, from Rotary clubs to legions and the vets and things like that. It's kind of endless. Some of the churches, but again, so many of these organizations are struggling themselves because dynamics have changed. But people, I would think, could help on a volunteer basis without even formally being a volunteer by just going to your website and liking and sharing what you have,
Absolutely.
talking about the good work that you're doing. Sometimes people don't want to, I don't want to do that much. And it's like, you don't have to, but you can still have an impact, by what I call being a giver of hope, and just raising the profile out there. Because it is hard when you talked about needing social media. That's changing constantly, what you're supposed to do and how you're supposed to do it. It's very difficult to
Indeed.
keep up with all of that stuff. And it's very costly if you have to hire it out.
One of the major donors this year were the authors of the Parkinson's Plan. This book just came out in the fall. And I met the author, who they have donated 25 copies to me. I have purchased at a huge discount another 25 copies. And the Parkinson's Plan, working together, will now go to a public library in each of the 50 states.
Oh, nice.
And so I guess here's a pitch, Lori. If there are states out there with public libraries listening in and want to receive not just the Parkinson's Plan, but a set of books that are both appropriate for kids and adults dealing with Alzheimer's, dementia, disability, they can email me at nanosbooks21@gmail and request the application for receiving these books later this year. And so it's our pitch to be able to make this happen, as well as the need for us to get into each of the 50 states. And I think after this year, we'll still be shy about 35 states, and looking for Title I schools that will be willing recipients. And I have an application process that we have with Nana's Books. And certainly I'm looking to start a list of schools for 2027 and beyond, to where, I can achieve my goal. And with enough financial support from all of these groups that may have small foundations willing to donate, or family members willing to place a donation in name of their family member they've lost. That is certainly something they can do through my donation approach as well. And so we have a very honorable service and resource that we put out there, and very, very proud that the success we've had in the 5 years is looking to expand well beyond my existence into a succession plan as well.
Well, and there are a lot of dementia-friendly libraries now that are out there. But again, there's not a really good list of who's, there's so many services that we don't know about. And so if you're listening to this, go ahead and grab a profile on Dementia Map, because we need to be able to find people and know where these resources are, or go to your library and see if they have them. And if they don't, encourage them to become a dementia-friendly library, because there is funding through the library organization to help them purchase books, and it comes and it goes in waves, in terms of how it's used. But, and they don't know, they don't necessarily know which books to always grab. But when you've got a vetted resource that understands and can help with coordination of all that, that's massively huge. And they do a lot, that the libraries are now getting involved a lot with the memory cafes as well. And so it could be incorporated to something like that. But I know that they also love to see authors come and read to the kids as well. So if there's authors out there that have those books and want to talk with Dennis, but that might be another step in, because you don't know which librarian's going to tell another librarian that's going to tell another librarian, and it kind of sparks and grows. Like Carol, who started the first dementia-friendly library in Roseville, Minnesota, she ended up doing a whole article that went out, and then people were like really interested in that, to their association, and that's kind of how that bubbled up. So word of mouth, I still swear, is the best. way to communicate and get people behind you, because it comes from an authentic place, an acknowledgement of what you're talking about and the good that it's doing. And that's so critically important with that. For the future, I know you mentioned you're not going to be around forever, and things. You also, are doing some things to kind of expand hope. And I know you facilitate a men's group. Why don't you talk about, your vision and hope for the future of your organization as a whole?
Well, the men's group that I facilitate is actually a spinoff from when I was a caregiver, because I found a men's group that I was part of, and I learned how to be a better caregiver. Well, I also learned that there are other people who are caregivers, and the person I had met, Tony Gittles, wrote a book on the 21 mistakes caregivers make and how to avoid them, and she's the one who taught me to be a better caregiver. And so together, the two of us now are making a big difference by visiting these schools when we're donating books and reading to the kids and doing that. But my men's support group actually meets once personally in Central Florida, in Winter Park, Florida, and then once on Zoom. And my Zoom meeting, these people can be anywhere in the country. And so if there is any interest in a men's group where we can talk about any issues amongst ourselves and find additional resources to help caregivers who are in the journey, write to me at nanasbooks21@gmail.com. I know I'm probably extending my services beyond my initial capability here, but maybe let's see how the waves go up and the tide rises. Because one of the hopes I have, Lori, is that we get enough information out there and support, that our support teams grow, so that people don't feel isolated to where they don't know where to turn, because the sound is not getting to them. The message is not getting to them. And with social media, we've got a different way of getting out, because newspapers are rare these days. And so we can't use newspapers to get pictures in front of people. We have to use social media. And if we're lucky enough, the TV might be there for one of our programs, like I've been successful a couple of times in opening new dementia-friendly dining restaurants. But the message about dementia has to come out to where resources are becoming more readable. And that includes public libraries. The fact that public libraries have interlibrary loan, that ought to be a key source of information, not just Google. It becomes necessary that people have resources that they can truly read in paper form, or if happily on tablet. But I'm only providing paper books to kids so that they have something they can take home, that they can read to their brother and sister, that they can read with their mom and dad, and that each of these books carries Nancy's story.
For over 30 years, Point of Grace has shared music, faith, and friendship with listeners across the country. Now Denise, Lee, and Shelley are inviting you into their circle. Welcome to Circle of Friends, the podcast.
It's Point of Grace.
Each week they're talking real life, current events, stories of true friendship, wisdom from God's Word, and all their favorite things. If you're looking for a little company, a few laughs, and a lot of Jesus to hold it together, Circle of Friends, the podcast, is waiting for you. Subscribe now wherever you listen or watch podcasts, and circle up with Point of Grace.
Want to keep God's Word with you wherever you go? The King James Bible Study KJV app by Salem Media makes it easy to read, study, share, and pray daily with the timeless KJV translation. Enjoy features like offline access, audio Bible listening, smart search, and tools to highlight, bookmark, and take notes, all designed to keep your Bible study simple and organized. Best of all, it's free to download in the Google Play Store. Growing your faith every day. Search for King James Bible Study KJV and download the app today.
Which I hope becomes an inspiration for some kids who may not understand that success and advocacy and support can come through all this.
Yeah, that's a critical message. I remember I had two Girl Scouts on one time, and this was kind of an interesting story, but it shows that kids don't always talk about what's going on at home when they're caring. And one of them had a grandpa, and she was struggling because he really couldn't communicate with her like he used to, and he didn't always recognize her. And she finally told her best friend. And then her best friend told her, I want to say it was her grandma had dementia. They had never talked about this journey before. And then so for, one of their projects, they created a tool that people could use to try to pull out information from the person if they're earlier on the journey or their family. But it kind of amplified again how this conversation isn't taking place, and it's a critical one. And that we don't recognize, that we're caregivers, and our carers or care partners or care companions, whatever you want to call them. But this is a role we play from the moment we're born. And I even say before we were born, and people always look at me like, what are you talking about? And I'm like, we don't realize how many conversations change because someone's pregnant. What we say to someone who's pregnant, how we feel their joy or their anxiousness or whatever. And then when a baby's born, they recognize the voices that they've heard, or the music that's been played. And, the conversations change from maybe something boring to, what color are you painting the nursery? Or do you have a theme? Or even though they're in the womb and they're hidden from us, they are parts. And that all comes into play. And I don't care what age you are. I don't care if you're the one that is ill or if you are one that's helping. We all go through all of these different stages in our lives. And we have to realize it's normal. How we interact with people is a normal way to decide how are we going to care for others. And one of the things that I love what you're doing is you're teaching about kindness and compassion. It pulls that judgment out of the door, and it develops the values that I think are missing in today's world. I look at how people talk to one another, and the comments that they make are so stark and downright abusive at times. And I'm like, what good does that do any of us? It doesn't. It rips people to shreds. And, when you're kind to somebody and you help them out, you receive so much more than what you give. And we hear that all the time. And yet I know even myself, when I broke my elbow recently, and I really didn't want any help, I want to do it all myself. But then I had to break down, and it's like, okay, put my boots on for me and lace them up and yank them off because I just couldn't do it, And, like my grandkids, they love doing that. Grandma, do you need help with this? Or, they love doing that. And it made me look at things different. But I know for myself, I'm one of those that kind of pushes back at being a receiver of help. But, and that's an important thing to break through too, that it's okay to receive help, that we live in.
Yep. Caregivers need to ask for help. Not just the person with the disease, but the care partner, the carer has got to ask for help because they cannot do it alone. And that is one of the issues that creates the stress among the caregivers that needs to be reduced. Care partnering initially when it's possible. And then that self-care you mentioned just briefly early in our conversation. But self-care among the caregiver is essential. And I try to use that every group meeting I have is to make sure they're taking care of themselves. Because if they can't take care of themselves, they can't take care of their loved one. But that message of kindness and compassion, Lori, it just resonates among the teachers and says, you have just made my day by helping support the values that we are trying to teach kids.
Mhm.
And that just is a wonderful, heartwarming experience that I know um, my wife and I are just loving at this point.
Well, and I'll give an example when my daughter, and she's in her mid 30s now, but when she was in kindergarten, I'll never forget the kindergarten teacher, at a conference going, "Oh, we just really want to thank you guys. Your daughter's so compassionate. She helps so and so in a wheelchair, and she helps another person who's a little slower, and we just really admire that." And she focused on the disabilities of the wheelchair and the
Mm-hmm.
ADHD or whatever. And I started laughing. And she goes, "Well, why are you laughing?" I said, "You don't understand. She doesn't see any of that. She just sees another kid that she wants to play with. And so she has to help them get from A to B or help them get through their work so they can go outside and play." I mean, her perspective is very different. She's not judging them on that. And I think sometimes we project, and I'm not pushing this on teachers at all, but I think in the real world, because of our judgments, our kids can pick up on those instead of just looking at people as human beings, and that we all have our vulnerabilities, no matter how hard we want to try and hide them. There's going to be a point in our life, or currently right now, where we could use a hand. And to me, we were put on this planet to live in community. And you look at like the blue zone, and they talk about, oh, if you go here, and they talk about the diet. And that's kind of the primary thing. But we've heard more over the years that's come out that it's not just diet, it's about being in relationship and community with others. And I totally think that's why my mom lived 30 years, is because for a good, I would say 27 of those, she felt part. She felt connected to people. And the last three were more difficult because she couldn't speak and she wasn't as mobile and all of those things. But I truly believe that's why she lived as long as she did. And so, you know, help extend a life, and extend your own by being kind and making the world a better place to live in. We need that more than ever these days, you know.
Agreed.
So thank you, Dennis, for doing all that you're doing. Anything that you want to mention that we haven't covered yet?
Well, Lori, being on your show and sharing the messages that we share in common just generates more synergy.
Mm-hmm.
And I love the fact that we have messages that resonate with each other and support what we're doing. And so if there's any way I can help you as well in trying to take this message farther, we need to do that. And so I look forward to our next visit. And thank you for putting my contact information along with this presentation. But we're very pleased that we are doing well, and I'm looking forward to visiting 5 new states this year and delivering books to over 2,000 students.
Wonderful. I'd love for one of those to be Minnesota, because that's where I'm at. But
well, let's talk.
Any expansion is great, and it's absolutely wonderful. So again, Dennis, thank you for your time. Thank you for your passion and your purpose, and thank your son too, and your board members. They're doing great work, and this is a wonderful thing. And to my audience, I always ask you to be a giver of hope. Like, click, and share. I'm not about tracking the numbers, because I can't even track them. They go out in so many different fashions. But there are people in your sphere of influence that can make a difference too, or that need this information that you might not even be aware of. And so we have to just heighten the resources, because when they're ready to grab them, they'll know you're a safe place that this was recommended from. Again, costs you no money, takes little time, huge impact. So one more time and wrap it up, check out Alzheimer Speaks for all of our free educational resources, as well as Dementia Map, which is our global resource directory. And if you've got a service, product, or tool, join. We have both free and paid plans, so everyone is welcome. Talk soon, everyone. Bye-bye.
over 30 years, Point of Grace has shared music, faith, and friendship with listeners across the country. Now Denise, Lee, and Shelley are inviting you into their circle. Welcome to Circle of Friends, the podcast.
It's Point of Grace.
Each week they're talking real life, current events, stories of true friendship, wisdom from God's Word, and all their favorite things. If you're looking for a little company, a few laughs, and a lot of Jesus to hold it together, Circle of Friends, the podcast is waiting for you. Subscribe now wherever you listen or watch podcasts, and circle up with Point of Grace.